Hi, Dr. Philip at the 21st Century Regenerative Medicine Institute, and today we are going to do a laser-guided umbilical cord stem cell procedure on Ed's bone-on-bone medial knee. This is called a light stem panel, and what we do is because the cells become frozen, we gently defrost them in the panel. These cells are actually ready to go. We have 1 cc of umbilical cord blood stem cells and 1 cc of umbilical cord membrane from the Wharton's jelly. And that way, using 2 types of cells, we have a complete array of growth factors, okay? And that way, you get 10 times the effect by using both types of tissue. The cord blood will have a lot of hemopoietic stem cells, which will grow into like blood vessels to get more nutrients to the knee. The membrane has more like collagen, hyaluronic acid, all the growth factors to actually regenerate the cartilage. And we're going to go ahead and deliver the cells to our nurse practitioner, Michelle. She's actually going to mix that with 1 cc of bicarbonate, because bicarbonate will make an alkaline environment for the cells to grow. All right. If you talk to any farmer, fruits and vegetables grow better in an alkaline environment. Guess what? Your body functions better in an alkaline environment. In fact, cancer cells cannot exist in an alkaline state, your body, your blood, but most of us have an acidic diet, drink acidic water, and that's why we get all these diseases. If you see over here, we are preparing Ed's knee to accept the cells, and we do that several ways. So this is a knee decompression device. And what this is doing, it's unloading the medial knee joint. We have it on a slight acute ankle to open up that medial joint. A, the needle will go in like butter, and B, it'll create negative pressure so the stem cells will be sucked into the medial knee joint. I already marked the target area, which is the medial joint capsule. We detect the point of greatest inflammation with the infrared thermometer, because the stem cells will go to the area of greatest inflammation. In his case, it's the medial inferior knee joint, where it is bone on bone, because he does have a genu varus, which is a bow leg. It's going to cause the medial joint loading. Are we ready for the procedure? Great. So we're going to go ahead and do that, and the light stem panel will help incubate the cells as well. Let me get the cryo spray.
You don't put the infrared light?
I will, but I'm doing the knees first. Once I do the knees, I do the infrared for all 3 body parts.
So before we graft the umbilical cord cells, instead of using lidocaine, which might damage the cells, I'm going to apply some cryo spray, which will numb the tissue, so the needle will go in more of a painless sensation. In fact, I call this procedure the bloodless mosquito bite procedure, because Michelle, rarely does she cause a drop of blood, and rarely does it hurt more than mosquito bite. So further ado, we're going to start the grafting under the laser guidance. So we're going to go for that medial knee joint right there. Look, anesthetize the area. The cryo spray. Here. I'm going to go more perpendicular. There you go.
Deep breath.
Good space. Good. Just get a little deeper. Good. You know, if you have any resistance, I could mark another point.
No, it's going.
Yeah, it's right in the capsule.
Light, touch the light.
Yeah.
Feel light, yeah.
Feel okay?
The strong light.
Feel okay?
Yeah. How many patients are you?
So how does that grow and go into a position where it surrounds
Let's get
in
them
the
on
middle of the 2 bones together?
Let's get them on the bus.
Well, the body's smart. It goes to wherever you have the greatest inflammation.
So that's how we biohack your body, Ed, is we're causing local inflammation. You know, people say inflammation is bad. Chronically, yes, but acutely, that's how prolotherapy works. They inject you with like lidocaine and procaine, and that kind of causes local inflammation to activate your body's repair processes, or a PRP. This, so after we put the cells in, look, now did it feel like a mosquito bite, if that?
Yeah. I am-
Didn't feel anything, right? Yeah, look, not one drop of blood, right? That's because when we decompress the joint, the needle has a space to go in without any resistance in that bone-on-bone
My
area.
pain tolerance is way up.
And then here's how we also activate the cells with these myofascial release tools. I'm actually irritating the tissue to cause local inflammation, which will activate the stem cells, and it'll also keep the cells in the target tissue, which is the medial knee joint on the inside. So after we irritate the tissue with the myofascial release tools, we apply the light emitting diodes. That's going to create more heat and local inflammation to keep the cells in the target tissue of the medial joint. It'll bioactivate the cells so they stay, they repair, they regenerate the cartilage, and replicate, continue to grow and divide. And then we're going to send you home with the home unit as our gift to you. You're going to put it on your knee half hour a day. It's a smaller unit, but it's going to be the same diodes. That's the most important, 630 nanometers. And that's a sweet spot to regenerate cartilage. Okay? All right. That's how we do it, folks. Our laser-guided umbilical cord stem cell therapy with light stimulation and knee decompression. Thanks for watching.